You are listening to Wellness Prescribed with Fisher-Titus Medical Center. And joining us in studio now from Fisher-Titus for Wellness Prescribed, we have Ashley Ballah, Senior Director of Ancillary Services at Fisher-Titus. So thank you so much for being with us today.
Thank you for having me.
So first of all, what are ancillary services?
So ancillary services are those supportive and diagnostic services that can assist our healthcare providers in caring for their patients.
And what sort of ancillary services are available at Fisher-Titus?
So we have our laboratory and our imaging departments. These departments help to screen for common conditions, which allow for early detection and intervention to help improve the overall healthcare outcomes. And then we have our rehab services, which can help patients restore their function and mobility after they have injuries or surgeries, and it helps reduce the time it takes to have them return to their normal daily activities.
Okay, so when we talk about the lab services, then what all does that entail? What services are available and how do they work?
So our lab is a full-service laboratory. It does provide testing for all disciplines. The diagnostic testing is performed 24/7. We are accredited through the College of American Pathologists and also by CLIA, which is the Clinical Laboratory for Improvement Amendments.
And where can people go to have those labs done?
So they can have it done at the Fisher-Titus Medical Center. The outpatient hours there are Monday through Thursday, 6 a.m. to 6 p.m., Fridays, 6 a.m. to 2 p.m., and Saturdays, 6 a.m. to 12 p.m. You can also make an appointment at any Fisher-Titus physician office. Our convenient care facility allows walk-ins, and the new Willard facility will also soon be allowing walk-in.
Oh, okay. So then talking about imaging, probably a little more going into that than just a walk-in appointment, I assume. So what sort of imaging examinations can be done at Fisher-Titus?
So we have several different modalities. All of the typical imaging studies can be done. So we have ultrasound, X-ray, CAT scan, MRI, nuclear medicine, mammography, and DEXA, which is bone density testing. And we also have PET CT available on site one time per week.
Okay, and so how can people schedule those appointments?
So the easiest way is to call our centralized scheduling department. We also have many same-day appointments available. You can get late appointments for both MRI and ultrasound, so it's convenient if you can't get there during the day. We also allow X-ray walk-ins anytime at the main campus. At Convenient Care, we have X-ray services the same hours of Convenient Care being open, so that's 9 a.m. to 7 p.m. weekdays and 9 a.m. to 3 p.m. on weekends. Willard will soon be having walk-ins. And our walk-in mammography at main campus is Monday through Friday, 9 a.m. to 4 p.m.
Okay, so Ashley Ballah, again, Senior Director of Ancillary Services at Fisher-Titus Medical Center, talking about those services. You had mentioned rehabilitation. Is that like physical therapy?
Yes, so that includes physical therapy, but also occupational therapy and speech therapy. We also have a pediatric therapy program and a cancer rehabilitation program, as well as athletic training that we provide in many of the local schools.
So where are those locations then for physical therapy and all of those therapies that you mentioned?
So we have it at our main campus. There's also outpatient therapy at the Convenient Care location, and most recently we opened at the Willard facility.
All right. So then with these different imaging services and different therapies that you offer there, are you using any sorts of new equipment? I know, things are always evolving and growing and new technologies are coming along all of the time. So what sort of new practices are being implemented at Fisher-Titus?
So we have a new lab automation line being installed right now. It will go live July 15th. We will start having X-ray services in Willard starting June 18th. And then we are getting ready for new mammography and stereotactic breast biopsy equipment coming this fall, hopefully in time for Breast Cancer Awareness Month.
Wow, that's really great. So if people want to get started with these services, is this something you have to talk to your primary care provider about, or is this something that it's like, oh, I know I need to get a mammogram. Can you just make that appointment yourself?
So most of our services will require a physician order, and some might require prior authorization, but that is something that we can help you out with. We have a prior authorization department to assist you through that process. However, there is no order required if you want a mammogram and you're over 40 with no pain or breast issues.
Oh, okay, great. So if people want to get more information then about this, if they maybe want to kind of start there and find out what they need to do, if they need to contact their provider, what sort of pre-authorizations they need, what's the best way to go about that then? The website to get information? Should they call? How do they handle that?
Yeah, they can go to our website at Fisher-Titus.org, and there's a lot of additional information as well as what numbers to call if you want more additional information.
All right. Well, Ashley Ballah, again, Senior Director of Ancillary Services at Fisher-Titus, thank you so much for taking the time to chat with us today.
Thank you.
You've been listening to Wellness Prescribed with Fisher-Titus Medical Center.